Good evening, everyone. Today's session is going to be really helpful and is led by Dr. Rashmi. She is going to talk about infertility and its evaluation. So, stick around until the end and ask us questions if you have any. Let's not keep you waiting any longer. Doctor, you have the stage.
Thank you so much, Vani. Yeah, hi. Very good evening to all the viewers who are logged in right now. I'm Dr. Rashmi Naik, Senior Obstetrician Gynecologist, a fertility specialist, and an endoscopic surgeon by profession. And I'm working at Apollo Cradle and Children Hospital, Rajajinagar branch. And today I'm here to talk to you about a very important topic on infertility and its evaluation, and why there is so much hue and cry about this topic of infertility. As you all know, it's a kind of it affects millions of people all over the world, and it is estimated that almost 1 out of 6 and to 7 people in this worldwide are affected with a problem of infertility in their lifetime. So I hope that I'm trying to keep this session very sweet and simple so that it is understandable easily by everyone. And I would be taking some questions at the end of this session. So if you have any of your doubts, queries, questions, comments, you can put it in the comment box, and then I'll try to take it at the end of the session for the last 10 minutes. So, coming to the topic proper, how do we define infertility? So, infertility is actually defined as a failure by the couple to achieve a pregnancy by the end of 12 months of regular unprotected intercourse. And what do we mean by regular? Regular means at least 3 times of sexual activity every week. And what do we mean by unprotected intercourse is when they do not use any birth control options. And as we all know that there are varieties of infertility patients, there are two types basically we are dealing with. One is called as primary infertility, and the other one is called as secondary infertility. What do we mean by primary? Primary is when a couple fail to achieve pregnancy throughout their life, not even once they have achieved it. And when do we call it as secondary? Is when they have achieved a pregnancy previously, regardless of its outcome. That means to say, it could have ended in a live birth, they could have had a previous one child, or it could have ended in miscarriages or abortions. That means to say, previously they've had quite a few miscarriages or abortions, and later they fail to achieve a pregnancy over a period of time as I defined. So these are the couples whom we put across as infertility couples, and these are the couples who walk into our clinics regularly for consultation. So, coming to how do we go evaluating such couples? So, basically, evaluating such couples is done by their own obstetrician gynecologist as a primary care center doctor, or even by a fertility specialist. So, anyone can attend to the couple at a basic level. So, at a basic level, what happens when a couple enters a clinic is that they will go through a detailed history taking part, wherein their problems are asked on how many years have been they've been trying to achieve a pregnancy. All this will be asked in detail and depth. And then coming to their married life, how many years they've been married for and how many years they've been actually trying for a pregnancy. Because these are the questions which we often come across and so many doubts the patients carry. Coming to whether the marriage is consanguineous or non-consanguineous, and then the most important history being the menstrual history of the lady, means whether she's having regular period cycles or irregular period cycles, if there is any other problem associated with her periods, that is, she could be suffering with severe pain, what we call as dysmenorrhea, or heavy menstrual bleeding, or she could be suffering with very less or minute or less bleeding, as we say. So there is many history which the doctor takes, and then the history of any medical disorders if they are coexisting. Some people could be suffering from thyroid disorders or prolactin disorders, or they could be suffering from diabetes, early diabetes in life, or hypertensive disorders, any kind of disorders if they are coexisting. And also the detailed history about any surgeries has been done previously for them for any other problems, because we do deal with many pelvic adhesions in such patients of who are suffering from infertility. and why the surgery was done. Was there any complications during the surgeries? And then again, the family history, whether they had any abnormal special child in their family, and has this been running in the family, like irregular periods or early menopause. So many such history and detailed examination is actually conducted at a primary level by your doctor. So coming to what all, next question most of my patients ask me is, what all tests do I need to undergo, doctor? So when I give them the list of tests, most of the patients are, perplexed. They're wondering why so many tests for us. So there are a lot number of tests. Again, the tests are basically designed or asked based on your requirement, need, and the problems the patient has been facing. As I said, whether the patient is a case of primary infertility or the patient is a case of secondary infertility. So lot of tests are actually advised by your doctor. So, before heading to how actually we evaluate a patient of infertility, I would like to speak a few words about how a natural pregnancy actually occurs in a couple. Because I feel if there is a basic understanding of how a natural pregnancy happens in a couple, I think it's much easier when I going on talk about the tests involved in couple. It becomes much easier for whoever is listening to understand this. So, coming to the explanation part of it, as you can see here, these are the ovaries which we say in the ladies, and these are the fallopian tubes, two fallopian tubes, one on the right and one on the left, and this is the uterus and this is the vagina. So, whenever a natural pregnancy has to happen, there has to be a good mature egg coming up, either on the right side or on the left side of the lady in the mid of the month, if provided the lady is having regular menstrual cycles. Suppose a mature egg is produced here, the same egg is going to be taken up by that side of the tube. And around the same time, if a sexual activity happens and the sperms are deposited here, these sperms are going to swim across, reach the egg here, and then here the conception happens. Once the conception happens, the embryo later, once it is formed, comes back and implants or sits inside the uterus as an embryo, which takes about 5 to 6 days naturally. So, this is a natural process which happens whenever there is a natural pregnancy happening. So, whenever an infertile couple comes to the clinic, so all the evaluation is done based on each organ separately. Now, I'm going to talk to you what are the tests which we actually do. When we are trying to evaluate the ovaries in the lady, we look for, basically, we do a scan, a pelvic scan, which is done in the beginning of the cycle, that is the second day or the third day of the cycle, which is called as a baseline pelvic scan, where we look for the number of eggs present in her ovaries, which we call as an antral follicle count. And also we look for anything abnormal looking in the ovaries. It could be a PCO looking ovary, or it could be an ovary which has other problems or abnormalities like endometriotic cyst or any other variety or types of cyst present in the ovary. And what does a scan also give us information about? When we do a scan in the middle of the cycle, that we call as a mid follicular or an ovulatory scan, we look for whether there is a mature egg coming out of the ovary or not naturally. And all these are looked by your doctor. So this is one reason why a scan is done on all the ladies on such a date. Coming to the blood test. So what are the blood tests which we do to look for the functions of the ovary? So whenever there is a dysfunction, that means to say whenever the ovary is not functioning properly and the patient is landing up in irregular periods, heavy bleeding, less bleeding, we also try to look for other hormonal abnormalities in the woman, like it could be thyroid, where we check for thyroid, prolactin hormones, we check for FSH, we check for LH hormones, we check for estradiol hormone, we check for progesterone or a P4 hormone. And the most important hormone in any woman, we call it as a serum AMH level. Why is this serum AMH talked about so much and why is it so important? As I actually always explain my ladies that consider your ovaries as your bank. Why? Because that's the bank which stores most of your eggs. So, whenever we check for a serum AMH level in a lady, we are trying to look for how much savings she still got inside of her. So once we know her savings, we are able to give her a better choice and an option. So these are the hormonal tests we look when we are doing the function of the ovary is considered. Now coming to the tubes. And how do we check for the tubes? Tubes, we have varieties of tests called as HSG, which is a basic most test. That is a hysterosalpingography, wherein we inject a dye here and take an X-ray at the same time, which is the simplest, most possible test available, wherein the test will tell us if there is any blockages in the tubes. So mainly we are looking at any abnormalities in the tubes. And why do the tubes become abnormal? Maybe due to many infections. There could be adhesions in the tubes, there could be blockages in the tubes. So tubes might not be functioning well, and these are the conditions which we need to recognize. And by doing either HSG or a sonosalpingography, we can look for the functioning or the appearance of the tube and where it is blocked exactly. So next, coming to the uterus. Again, how do we evaluate the uterus is by basically an ultrasonographic test done. So in that test, we are looking at the shape of the uterus, whether the shape is good, normal. There are so many abnormal shapes of the uterus which happens in congenital abnormalities, and there could be so many other problems inside the uterus, like there could be adenomyosis, there could be fibroids inside the uterus, there could be a congenital septate uterus, which we say, wherein your single cavity might have become two cavity or a double cavity uterus, what we say. So most of these tests, simple, can be found out by a 3D ultrasonography. Sometimes we might also have to need the requirement of an MRI scan, and also the most advanced test being a hysteroscopy or a diagnostic laparoscopy. Even that is suggested in many of the patients sometimes, when we have to look at the cavity in particular, wherein we introduce a camera inside and we look for the cavity of the uterus, whether it's normal or not. And at the same time, sometimes in conditions like infective conditions like endometriosis, we also take a biopsy from that region just to look for whether it is infected. And how do we go about treating? As we all know, India is highly affected with tuberculosis, and hence we have a lot of tuberculous patients who are also landing up with infertility. So we do a hysteroscopy wherein we put a camera from here and look for the uterus, and we also put a camera from through your abdomen, which we call as a laparoscopy, and at the same time we look for the tubes, and if the tubes are plastered or adhered or they are free to movable, and also whether they are patent, they are open or not. So coming to, these are few of the basic tests we do for the females when they come with infertility. Apart from this, we also do elaborate testing of females who have landed up with secondary infertility, wherein they have history of multiple abortions. There we look screening for many other problems, like we could even do genetic testing, we could do APLA screening, and many other such blood tests will be advised. Again, all these advice of the tests are based on the necessity and the requirement of the patient. So next, coming to how do we evaluate the males when they come to us for fertility. So males, as we all know, again in males also we look for many hormonal evaluation. Basically, we look at FSH, prolactin, thyroid hormones. Yes, we also have to rule out diabetes in men. And we also look for semen analysis, which is the most important test in a male. So how do we go doing the semen analysis is when the men, they maintain an abstinence of 3 days to 5 days, they can go and do the semen analysis. And what are the things which we look for when we do a semen analysis in a male is we look at three important parameters. One is the numbers of the count, or the number or the count of the sperms. Second is whether they are motile, that is, they are able to swim and go up. As I said, the sperms should be capable of swimming up and reaching the egg here if at all they need to achieve a pregnancy. And the third most important morphology is being the whether the sperm looks normal or not. So we have certain cutoff guidelines for all these parameters, and if they are all fitting into these, then they are fine to go. But if there is any abnormality, as we say, the numbers could be less, where we call as oligospermia, or there could be the normal sperms might be zero, the motility could be zero, that is, their movement could be zero. So there are many situations where we see abnormal parameters in the sperm analysis when we do, and based on that, we again go further testing the males. Sometimes they would also require the need of a scrotal ultrasound, wherein we look for varicoceles and issues related to the testicles. And sometimes when we see severe oligospermia, that is when the counts are too very low, we also do the genetic testing in male to rule out other genetic causes of impaired production of sperms in them. And also sometimes some other MRI screenings might be required whenever there is gonadal dysfunction happening in the pituitary gland. So there are many varieties of tests, and again, all the tests are not advised to all the patients. We try to keep the test basically minimal in the beginning based on the needs and requirement of the patient. And if the patient history or complaint says so that we need in-depth evaluation, yes, all the tests will be required for those kind of couples. So this is how we go about evaluating an infertility couple who enters the clinic. And as I said, how when should a couple arrive at the clinic? A very important question these days, which I find it a little difficult to answer, because most of the couples or the working women these days who walk into my clinic, they are quite career oriented, and they would have been married for more than 4 or 5 years, but yet they wouldn't be trying for a baby. So when they enter my clinic at the age of 32, 33, they ask me, this is just an example I'm giving, they just ask me whether is it the right time for me to try for a pregnancy, or can I defer it by another 1 to 2 more years, because I have some career options to go ahead with. So that's when all these hormonal evaluations come into picture, where I say at least a basic serum AMH and an FSH needs to be done in such lady, especially on the second, third day of the period, if possible, with the scan clubbed together. Along with that, a semen analysis, a basic semen analysis in her partner. I think by doing these things, we will be able to properly advise the patient whether they need to speeden up the process of trying for a pregnancy, or they can defer it by few years. So overall, I would like to say that whenever you are facing the problem of infertility, kindly do consult your doctor at the earliest. Take their opinion, suggestions. In case they advise you for few tests, as I've already mentioned across, kindly go through those tests so that you know where do you fit in, and whether a simple treatment should be enough, or you can defer pregnancy by a few more months or years, or you should speeden up everything, because most of the couples come with very low serum AMH, and when we give them the option of a donor egg or a donor embryo, it's not easily taken by everybody. But yes, but if you evaluate yourself early, because the nowadays the influence of social drinking, social smoking, I think all these environmental changes, probably obesity, eating a lot of junk food, not maintaining a good healthy diet, not doing daily routine exercises. I think most of the people, most of my ladies, I think I see them all coming to clinic with irregular period cycles, PCO symptoms. And their first question they ask me at the age of 20s, they are in their 20s, and they ask me, is it going to be difficult for me to achieve a pregnancy? Yes. So kindly consult your doctor, take the advice early, and start your treatments or maybe some lifestyle changes at the earliest, so that you avoid landing up in this situation. So I think by saying all these things, I would like to end my talk on infertility and its evaluation. I tried to keep it very simple as possible. I hope it was informative enough and useful enough for few of the people at least who are going through this phase right now in their life. And I think now I would be taking up few questions or queries if you have any for the next 10 minutes. So I think I already have a couple of questions here given by a few of my, I think, in-house listeners and patients already. So, so they're asking, what are the common causes of infertility in a woman? I think I've already listed out quite a lot. As I said, ovulatory dysfunctions, as I said, a woman who is suffering with irregular cycles, wherein a mature egg is not coming up, that we call it as an anovulatory cycles. those are the women who actually have these problems, and the women wherein they could be suffering with fibroids, adenomyosis, conditions like endometriosis or thyroid disorders, or even prolactin disorders, or the ones who are going for an early menopause or an early ovarian failure, what we say. Those are the women, and sometimes these STIs or the sexually transmitted infections could be bacterial, fungal, viral, any of those, which could cause pelvic infection, inflammation in them, and lead to tubal disorders or tubal dysfunctions, leading to infertility. So I would say a lot number of causes are there, especially in women, and including genetic causes, sometimes congenital. As I said, they could be having some congenitally abnormal uterus, which will be leading to infertility or repeated losses of pregnancy. So I think a lot of causes I've already listed. And so next question is, what is HSG, hysterosalpingography? I think I already told you about it in my talk, that it is the simplest basic test available for us to test for the tubal patency, especially not the function. You should know that, wherein we are pushing a dye from below and then we are taking a radiographic dye which is picked up on an X-ray, and we take an X-ray on top at the same time. And this tells us whether the radiographic dye has passed through the tubes and come out spilled or not. And this is the simplest test available for us when we are evaluating for the tubes, especially in a female. And another question is infertility always treatable? Okay. Yeah, this is a bit of a difficult question. I think we doctors, we do a good, fair enough job of assessing the patients, analyzing and giving them the best offer of treatment when they come with infertility and problems. And we try our best to treat obviously everybody, and we want everybody to finally take home a baby in their hand. But it's not always treatable. Yes, there are few conditions, there are few medical problems wherein we cannot offer them fertility options at all. So I would not like to list it out here in this talk today. Probably we can take it up as a different topic altogether. What are the causes of infertility? How do we treat? But it's a huge topic altogether. And again, the next question is, how can lifestyle affect infertility? As I already mentioned, yes, lifestyle affects people a lot these days because of, as I said, the junk eating, too much into smoking and chronic alcoholism, and these days vaping and many other things, I think, which the youngsters are getting involved into, and where there's no check on the diet and lack of exercise. I think all these increases the oxidative process which happens inside your body, which is harmful for the eggs also, and which is harmful for the sperms also. So basically, whenever they are in high in such kind of process, we get poor quality eggs and we get poor quality sperms, and finally which leads to poor quality embryos, and probably they either land up with early miscarriages or increased number of miscarriages if they at all become pregnant, or they could land up in infertility, unable to achieve a pregnancy. So yes, lifestyle modification is a huge task which everybody has to take it up early in life. Try to maintain a normal, healthy BMI, we say, that is the basal metabolic index. That is, your height should be matching with your weight, and trying to keep yourself active every day with at least routinely 45 minutes of exercise every day, and at least the exercises are managed for 5 days a week. And also try to avoid eating these junk and processed foods, and try to keep to a healthy lifestyle. And when should a couple seek evaluation for infertility is what I was talking all this while about. I think I've already answered that question. And the next question is, how do you go about assessing ovulation? Okay, so there are plenty number of tests to assess ovulation, but the most easiest, simplest for a gynecologist or a fertility doctor is by way of doing an ultrasonography or a pelvic scan, what I already mentioned. We do these scans in the middle of the period cycle, provided the lady is having regular period cycle or if she is on a fertility treatment cycle. So such are the individuals whom we call in the mid of the period to check whether there is ovulation happening or not, wherein quite a few, like multiple scans, 2 or 3 might be required on an alternate day basis, starting from about day 12 to day 14, day 16 of their month. And that's the time where we can do the assessment of whether ovulation has happened or not. And there are few blood tests which also can be done. There are few kit tests like LH kit tests, and the blood test like a progesterone level can be done, which will also indicate whether there has been an ovulation or not. But these are a little laborious, little difficult to interpret. So I would say scan would be the best one as of now. And I think I have come to the end of the topic by answering all these questions. I hope that it was informative enough and it has helped quite a few people to kind of clear their doubts and queries about what is infertility and when should they evaluate themselves and how should they go about evaluating themselves. So I don't know at the end whether should I be telling ನಮಸ್ಕಾರ ನಮ್ಮ ಕನ್ನಡ ವೀಕ್ಷಕರಿಗೆಲ್ರಿಗೂ, ಯಾಕೆಂದ್ರೆ ಐ ಆಮ್ ಟಾಕಿಂಗ್ ಫ್ರಮ್ ಬೆಂಗಳೂರು ಅಂಡ್ ಕನ್ನಡದಲ್ಲಿ ಗಾದೆ ಇರೋ ತರ ಹೇಳ್ತಾರಲ್ಲ, ಎಲ್ಲ ಸಮಸ್ಯೆಗೂ ಒಂದು ಪರಿಹಾರ ಇದ್ದೇ ಇರುತ್ತೆ ಅಂತ. ಸೊ ನಿಮ್ಗೇನಾದ್ರೂ ಈ ತರ ಬಂಜೆತನದ ಸಮಸ್ಯೆ ಇದ್ರೆ, ಕಾಡ್ತಿದ್ರೆ, ದಯವಿಟ್ಟು ನಿಮ್ಮ ವೈದ್ಯರ ಹತ್ರ ಹೋಗಿ ಅವರ ಸಲಹೆ ಪಡೀರಿ ಅಂಡ್ ಅವ್ರು ಕೊಡುವಂತ ಪರಿಹಾರವನ್ನು ದಯವಿಟ್ಟು ಯು ನೀಡ್ ಟು ಟೇಕ್ ಇಟ್ ಸೀರಿಯಸ್ಲಿ, ರೈಟ್? ಸೊ ಇದನ್ನ ಹೇಳ್ತಾ ನಾನು ಇವತ್ತಿನ ನನ್ನ ಈ ಟಾಪಿಕ್ನ ನಾನು ಐ ಥಿಂಕ್ ಮುಗಿಸ್ತಾ ಇದ್ದೀನಿ. ಅಂಡ್ ಫಾರ್ ಎನಿ queries or appointments you need to take or consult, kindly call Apollo Cradle Hospital, Children's Hospital, Rajajinagar on 040 490 47777, or you can also log on to www.apollocradle.com for any such further queries, or even you can even take an appointment if need be. Thank you so much to all of you for watching this patiently and listening to me so patiently. And have a great evening and a great week ahead of you. Thank you all. God bless you.